I was knocked unconscious by a patient. Patients have tried to stab me.
A video recently published by the New York Times is sparking new discussions about workplace violence in healthcare settings.
And that video showcases really powerful and emotional stories of workers from the UVM Health Network.
NBC5's Tyler Boronsky spoke to a registered nurse and local healthcare leaders about how they're trying to make change. Tyler?
Yeah, Alice, Jack, that video included personal testimonies from frontline workers for the UVM Health Network about the acts of violence they've endured while doing their jobs. And they say it's only increased over the years, and they're tired of staying silent.
They're the ones helping those in need. But now more than ever, frontline healthcare staff workers, like Matthew Loof, need their own medical help.
We have had nurses and techs and physicians that have been punched and kicked and spit on, stabbed. I've had someone try to cut me with a razor blade.
The New York Times reports healthcare workers are 5 times more likely to suffer a violent workplace injury, with 75% of frontline workers saying they've experienced violence in the past year. If you ask Dr. Julie Veith, UVM Medical Center's emergency department chair, those numbers may be low estimates because of the mindset workers have taken in recent years.
Violence in the healthcare setting was sort of acceptable. Patients were in crisis. We should just deal with it. We should accept that that's part of our job. And nobody goes into healthcare expecting to be a punching bag.
Loof says substance use disorder, mental health, and societal changes are all factors to the increase in violence from both patients and hospital visitors, but also notes there's no single cause.
It is really multifactorial. It's a lot of things influenced, and it really is people that you wouldn't expect. It is more behavioral, and it's, like you said, folks that should know better.
UVM Health Network President Dr. Sunny Eapen says the network takes safety seriously. It's increasing security, upping its use of metal detectors, and training staff through de-escalating situations. But Eapen understands more needs to be done.
It's going to be a complex set of many things, including many of the things we've started to do and other things that we're going to have to do together with our communities to solve this.
This year, the Vermont legislature sent a bill to Governor Phil Scott that called for stiffer criminal penalties for people who harm hospital workers or other emergency medical providers. The governor signed it into law.
What that has done is enabled us to file police reports that classify these events differently, and so police are able to take that report.
Progress, Loof says, but he is certain the rise in violence has led co-workers to leave their jobs over the last few years. And he tells us he almost quit too, but he chose to stay, seeing helping those in need as fulfilling despite all the new challenges.
The ability to care for people, to help folks out on their tough days, to practice medicine at a really high level, and to work with the best team out there is what kept me in the ED.
If you want to watch the video from the New York Times featuring the UVM Health Network employees, we have a link to our website, mynbc5.com. In the newsroom, Tyler Bronsky, NBC5 News.